Hey everyone, in this video I'm going to use my own knee to show you a good way to figure out if you have a medial meniscus injury or Pes Anserine Bursitis. Hey everyone, I'm Sebastian at Performance Way Sports Care, part of the local world famous chiropractors in Costa Mesa, California. I know a lot of you probably said, well, is it Pes Anserine or Pes Anserine? Well, I've said Pes Anserine for a long time. Maybe my professor was a different type of person, but either way, that's what I call it. You call it what you want. Now in this video, I'm going to use my knee as figure out anatomical structures so you can figure out where those different areas are, so you can make an educated decision about what to do with it. Keep in mind, meniscal injuries that don't create locking, complete locking of the knee joint are typically rehab cases. They do not often require surgery, but if your knee is stuck and cannot bend in either position, a lot of times it's more of a surgical case. Pes Anserine tendinitis or tendinopathy or bursitis does not really require surgery really at all. It's usually a rehab case till proven otherwise, and a lot of times you need to figure out what exercises to do so you don't provoke the area versus just doing everything and finding out that it actually bothers it. There are ways to figure this out, so if you end up going through an assessment with somebody like us, we can figure out what's safe for you and what's not. Our link is in the description below. Now, what we can do here is we can actually find some larger anatomical structures like bony prominences to figure out what a good, where these different areas are. Obviously, everybody can usually figure out where their kneecap is, and if you slide your hand down and you start to figure out there's something really hard here, and it kind of makes a teardrop formation, that is your kneecap, all right? Now, your kneecap, if you slide all the way down, you'll find it drops off into something soft. That is your patellar tendon. All right, and the patellar tendon crosses the actual joint, all right? So keep in mind where that teardrop is there, and then we're gonna take this finger and slide it up the inner side of our shin until we get to this swoop that kind of comes out. That is part of the tibial plateau, and it's the bottom side of the joint, all right? And so we're gonna slide this guy up and we're gonna start making our way until we feel a drop-off point. Now that drop-off point right over the hump and into the drop-off there is the joint line. And so joint line palpation is right where the medial meniscus is, and you can see that it's pretty close to the same line of when you dropped off the kneecap as well into the gully. So this whole area can be explored. You can actually run your finger along the ridge forward and backwards and figure out if there's any tenderness associated to it. Now keep in mind that tenderness in the joint line here is not only with meniscal tears or meniscal irritation, it can be happening with many different things as well. But usually joint line palpation is pretty significant and pretty tender when it comes to meniscal injuries. You also may notice a little bit of swelling into these areas right around the patellar tendon, which is why it's really nice to palpate over the kneecap, onto the patellar tendon, and then off of it. You may have to compare side to side. There's a normal amount of bogginess that is right here even on knees that aren't really symptomatic or having any problems. And so make sure that you compare side to side, but you may notice these areas a little bit more puffy with something like a meniscal irritation. Now onto the Pes Anserine. It's important to note that the meniscus does not extend down, okay? The meniscus is just in the joint line, really. Usually hurts more with twisting, a little bit of clicking, grinding, or crepitus as we call it. But the Pes Anserine is, remember when you went up the swoop? It's actually in the gully of the swoop, okay? That's the area right into here where the Pes Anserine and all those tendons attach, and the bursa is right there as well. Now earlier I was talking to somebody who said, well, I think I have Pes Anserine bursitis. And I said, why do you think that? And they said, because it's tender here. And I said, but it's not swollen. The thing is, a bursa is a fluid sac. It's a normal occurring thing, but if it has a bursitis, a inflammation, then it means that there's swelling there. And if there's no big swelling noticeable, in contrast to the other side, it's not probably a Pes Anserine problem either. Now, it's important to note that pain into these two areas are not only these two things. And so let's think of the good stuff. If there's no bruising there, if there's no swelling there, but it is tender, a lot of times this is from something like referred pain from something like the infrapatellar nerve or the saphenous nerve as it passes through. These are fairly easy to treat. A lot of times we use stuff like skin rolling, where you grab your skin and you just roll through the area. It is pretty tender on everybody, but a lot of times this in itself, rolling the skin, helps out with sensitivity. Now, it's important to note that if skin rolling does help you, it's not the only thing you need to be doing. It's just a really easy way to do your metaphorical medication. And so normally you have to look up at the hip or at the ankle and need to have an assessment performed to figure out why the knee or why the nerve passing through or why the meniscus or why the Pes Anserine Bursa is becoming so inflamed. The knee itself is a dummy joint. Typically you look above or below it, which includes pelvis and core function, to figure out why it's taking the hit. The most common scenario with knees are non-traumatic. Non-traumatic knees are pretty much always faults of other joints. So you need to have an assessment performed. You can reach out to us. Our link is in the description below. Subscribe to the channel, like our videos. We have a lot more videos on knee problems on YouTube.